Welcome everybody to the Pain Podcast with Le Pub Scientifique. And today I'm the host. My name is Tim Beams and I'm a pain specialist physiotherapist. And I have Bart Van Buchem joining me, also a pain specialist physio. And today we are going to be talking about difficult conversations. And in particular, we're going to discuss when people, it's probably one of those sort of trickiest conversations actually that people can have in pain care. What to do when someone comes to you, perhaps they have a persistent pain problem and they just want a quick fix. So we're going to explore some communication strategies, a bit of psychology around it, and figure out how we can better work with people who, come with those, I would say almost like a need. Yeah. So,
Yep.
Bart, first, good morning, first of all, and great to see you.
Good day again.
Yeah. I feel like we've got a lot to say here. We have talked a little bit around quick fix mentality before, haven't we? So,
Yeah, for sure.
so should we just sort of take a couple of minutes to ground us in what that means? So if someone comes to you, they want a quick fix, what's sort of at the heart of that, and what are you thinking in those moments?
Oh, that's probably it's an expectation, right? That's the first thing that comes to my mind. If you want a quick fix, I think it's a human right. If there's a quick fix, why not get the quick fix? Right? So I don't think there's anything bad. It could be like something you hope for, you wish for. So I think if people are really deliberately or explicitly asking for a quick fix, I guess that's, in my view, in my experience, people in the way they they pronounce it, like, oh, I would love you to do something that takes away all my problems. But the second thing is they say, and I know it's not possible. So I rarely get someone to see that is very strong in their beliefs. So like, you have to fix me, and that's what it has to be. And I don't give a shit about how you're gonna do it. It may have. Well, maybe that's my context of work, where I see people generally who have been struggling for a while, so they have gone through hope and disaster over the years sometimes. But honestly, I think it's a right to have, like, if there's a quick fix, you should you should allow people to think or hope for it. It's also something that brings the person to you. And there's a difference between what you wish how it would, but because if I need extended surgery, I would love that to be a quick fix. But in the end, it's extensive surgery, and it's probably gonna take some rehab afterwards, and I'm not gonna feel very good afterwards. It's gonna take some time, but I wish I could be a quick fix. Just put me to sleep and wake me up when everything is cool again. So I don't think it's specifically to chronic pain. I think it's widely understandable thing we as a human that we prefer quick.
Yeah. As you're saying that, sorry, I'm going to jump in, but as you're saying that, I'm thinking about, and like when a famous sports person goes and has surgery and the reporting is, everything went really well, they've sorted the problem in surgery, but there's still, as you say, there's still recovery from surgery and rehabilitation back into your sport as well. So there isn't, although if you want, the problem might be in some ways rectified, there's still a long way to go in terms of resolution and recovery.
Yeah. So I think if people are sort of referring to something that the other guy, the sports person, has had this quick fix, but it is. I think it's another debate on what is it. What's the definition of a quick fix? Is that someone else is solving your problem, Or is it that it is probably not going to be too much effort or uncomfortable? Or it's just a wish for, I don't want this life. I just want to move on and take back control. But like I said, I rarely get someone to see who is really strong in their beliefs that it is literally a quick fix, like fixing your car, repair or replacing the thing that is replacing the thing in your body to solve the problem, because everyone would acknowledge, almost everyone, I guess, that it's probably not going to work like that, because humans and bodies are quite complex and interesting as well. So, and again, it's a way of probably being quite explicit or vocal about what you want, right? And I'm not sure, how is your experience there, Timmy? Because you might see a different population compared to mine, but I can see that there might be differences as well.
Yeah. No, I think we're biased in a way because people who I typically see have been experiencing problems for some time. There's still threat there, isn't there? The threat of what pain means to someone, or threat of the impact on their life or work, or and you can understand why you want to remove that threat. So yeah, in a way, that's you can understand it absolutely. Like if it's possible, if it's available, then awesome. And I've massively softened from, the messaging out there about being, making someone an autonomous part of the process, giving them and empowering them. But to begin with, actually just being able to check in and notice, like if someone is seeking that quick fix, there's a message in there, and actually being able to understand what that might be for that person, I think is a good starting place. So
totally. Yeah. That's where the conversation, I think this definition of a quick fix, especially when someone is asking for something, could you just do this to me? Or even if people are asking for a quick fix and being very specific about, can you do this manip, or could you prescribe me this drug? Even then, it's probably not because they would expect you to solve the whole problem, but there might be something more acute, because tomorrow I have this wedding, or tomorrow I have to do whatever to look after my kids. So there could be reasons why people feel the urgency of, I need something now. And don't get me wrong, because sometimes I think from a physiotherapy or, well, even like a medical field as well, I think we do have some quick fixes, which probably don't last for long, but they might do the job for, let's say, the 24-hour. Whether it's going to be drugs or it's a specific treatment, if you think that could have short-term relief, which could probably be very helpful at some stage. So I'm not saying we shouldn't do any type of quick fixes at all, but it depends on the situation, as well as that is probably communicated that it's probably not going to solve the whole thing, but it's only temporarily thing, which is fine. I think that I would feel totally comfortable with delivering that type of care at certain circumstances.
Yeah, I totally agree. Yeah, and then that might be a beautiful window of opportunity that says, look, this is changeable. We can work with this. You've got some control in it, or whatever that might be. So yeah, I agree with you. I'm not a sort of black and white, you must not do anything passive, because actually there's merit to that as well. Okay, so let's just move on a little bit. So we've sort of getting to understand and in a way sort of position ourselves in why someone might look for or want a quick fix. In terms of you working with that, so what are the key sort of, if you want, communication strategies that you start utilizing when you realize someone's coming to you and they want that quick fix then?
Yeah, so probably that's where I think quick fix, as in to some degree, has become not just it probably is the way it's presented. Then it's our conclusion from a therapeutic approach or therapeutic um, perspective that we think, oh, that's a quick fix that you are asking for. But for the person, it may be just what they desire. um, I think so. Step one probably is trying to figure out where this desire comes from, and I can be quite straightforward, maybe a little bit Dutch in that perspective, and say, well, why not tomorrow? Why now? And I think depending on your relationship with this person, you can think of how you're going to describe how you're going to discuss this, right? But the first thing is trying to figure out where this desire comes from, and it could be whatever. And I can see people like, I'm done. I'm fed up with it. I'm totally fed up with it, and I want a solution right now,
Yeah.
which probably tells me, all right, so we can see what's going on. So what does make you that it's today? So what happened? So many people sometimes, and then in this conversation, you will figure out then there is a context, there is a reason for, and it's not just that moment. But it's also very important, I guess, when you already have a relationship and people keep asking for a quick fix, and you probably have to figure out what's going on with expectations. So you probably you obviously didn't sort of had found a way to meet your expectations of the therapeutic, let's say, potential results, and how to evaluate that. I think from let's say old school CBT, that there has been a movement that said, don't pay attention to the pain, don't even ask for it, ask for activities. I think that could be also, that would be the elephant in the room. And I've seen many therapists struggling with that. But only asking for the pain probably is not also not the way to go. So from a communicative perspective and psychology, you have to dig a bit deeper in the reason why. And once that's sort of cleared up, you can decide and have a shared decision making process where you can see, all right, so what is what we can and what's we can't do. So I think that's sort of not putting you in that they would expect you to use a magic wand. I think they were checking in with you what you actually can do, and maybe at that stage they need to calm down first, and probably calming down that requires more than just a few words. So you could probably have some interventions that help people to calm down, and then figuring out how to what to do next. And I think it's in my clinic, it probably will people when they suddenly require quick fix. Usually that's like a panic.
Yeah.
There's something acute coming. It's something happened that requires urgent need of relief, which we can we can discuss that and how to figure out how to meet that expectation. Because I think people would be very, and that's my experience as well, they are very happy to sort of shape or sort of challenge that expectation and feeling relieved because the problem was maybe not as big as they thought it would have been. Just to give it some different perspective. So I think that would be all about reframing. It's about understanding. It's about understanding the context of the patient, and then you can move on from there. And it's probably easier to know what to do if you have this clear understanding of the reason why the quick fix is required at that stage.
The need and the urgency behind it. Absolutely.
Absolutely. Yeah.
So I'm hearing within that there's an element of listening, building trust, validating experience, sort of really truly being open to hearing what that person has to say as well.
Yeah, and there could be a social, cultural part as well. So it could be the partner said, "Well, you've seen this physiotherapist for like 5 times now. When is it? When do you start? When do you stop moaning about your back pain?" So it could not necessarily, it doesn't have necessarily have to be the patient itself, but it could be their environment is expecting something to happen. I think that's also part of the system that you probably have to, at least you have to take in account as a part of the conversation or what's going on, why it's there. And sometimes, yeah, having that as a intervention as well, you could say, to see that these expectations probably can be very destructive or disruptive through the therapeutic sessions or the approach if instant recovery is not happening.
Yeah. Do you know, just as you're saying these things, I'm just reminded of a conversation with the patient I had very recently, and they, at the beginning of the session, there was very much a, I want you to get rid of, or I want to get rid of this pain. I don't think it was put on me, but it was, there was, I just want to get rid of this pain. And then near the end of the session, they reflected back and said, I think a sort of really wise reflection, actually, which struck me, because they said, at the beginning of the session, I said, I just want to get rid of this pain. But now I'm realizing that it's much more than that. And in fact, if I reflect now, I want to be strong to be able to play with my children again. So it was a really interesting sort of reflect back. You have this initial, I just want to be fixed, but you start to hear coming out in the need, and absolutely that makes so much sense, doesn't it?
Yeah, thinking or finding a way of finding relief or seeking relief is there is a merit in like if the pain eases or you have a relief of pain, you probably will have a better, much better function like that. That's very likely. But from a treatment point of view, you probably would expect, well, what's the worst thing you can have? What happened? And it's probably you lost life. You lost reasons for what would, like you said, I want to play, or I want to get back to the playing fields, or I want to spend time with my friends and being more happy about what's going on. So that's the worries, obviously, and I think the solution probably sits where you can have at least some sense of agency and control over your bodily functions again. But also, like you said, many people feel like, yeah, I can't change the pain, but you can change the way your strategies and how you cope through. And in the end, and I think that's something probably quite instrumental there, that there's a it's very likely that pain would have a very different could be a very different experience when people don't feel the urgency necessarily, or they don't necessarily are in panic. I use sometimes to use the metaphor. If you have your green glasses on, you probably wouldn't have exactly the same, let's say, bodily experience, but it's in the way how you perceive it. Maybe you say, "Oh, I can handle this, right? And I can do the things that I like to do." But if you're wearing these dark glasses, these red dark glasses, it would feel really different, and you don't feel the resilience that you need to cope with it, especially when it's on a short term, because it's not so likely that it's going to shift, especially when people are suffering chronic pain for years. Why would it just disappear at some point? But people do experience waves of inactivity, but also in quality of life, and also in their experience of pain. So I find it really interesting how you shift it instead of getting rid of the pain? Is there another way? Is there another way of doing that, right?
Yeah.
Is there a way of taking off these glasses, these dark, bloody glasses, and now get into the, let's say, is there a different color available that could help you to find back your resilience? And so that there are ways of reframing and therefore finding new strategies that actually can happen in the clinic. And I think that's the next part we should talk about. So what is it actually what you're going to do in the clinic to make that work? Because I'm pretty comfortable to say that it's probably not going to happen overnight, but it's not necessarily going to happen through cognitive instructive therapy. I think you have to do something. You have to build trust in that way.
I agree. Yeah. So I'm just sort of summarizing a little bit of what I'm hearing there, because you're sort of dropping in, I think, to the sort of perceptual phenomena of pain or the experience of pain. And as I'm hearing it, and I'm in tune with this, is that we have control over our actions, putting on a pair of red glasses versus a pair of green glasses. I mean, but we don't have the control of the outcome of those actions. So it's just that you are offering an opportunity to experience the world in a different way. And that might mean that there is a shift and a change in the experience, including of pain. So yeah, like you say, let's sort of lead on to that next point, which is taking that action, the first step. So someone comes with urgency, they're distressed, they're suffering, maybe even within the meaning of pain, there's something potentially quite harmful and troubling going on there. We sit with them, we meet them, we make sense of that together, we validate the experience, we build some trust, we talk about expectations, then what? And that sounds like we're at that next stage, which is the then what? You know, what do we do at that point?
Yeah, it depends, right? What are you might reflect on this as well, but there could be zillions of numerous examples here. But let's say that things you can control. I would say things like you can control movement, strategy of movement. You can see if even if breathing is an opportunity, but also reducing the threat value. So there could be this cognitive, I can't do this. Well, let's figure out a way how you can. And if you're worried about something that could be like, oh shit, I think my back is broken or whatever, something happens. I think I got this herniated disc right now. So we can actually check it out, right? So even running a physical examination could be a way of reducing the threat and then exposing people to the movement they probably were trying to avoid or were avoiding, and then using that experience and see what's happening. And you can calm down right now. So you can actually, so once they come in, what they came in and they, oh, I'm buggered, right? And then they leave the clinic. I said, actually, I can do much more than I thought. And there are other ways of doing it. Or understanding what you need to do. All right. So there could be strategies that tell you, so how do you, if you have a massive flare up, instead of instructing someone what to do at home, so let's do it together. Let's do this type of exercise. This could be any kind of relaxation or even movement. I think you repeating the exercises you have considered to be useful as a, let's say, de-threatening or like relaxing or calming or pain reducing type of exercises, you can see how you can do it together, right? And if people can treat themselves, for example, you can get strategies that could help, positions that actually help you to find a moment that actually doesn't improve or increases the pain. If it comes to back pain, one of these postures that generally do very well is lying on your back with a comfortable pillow and with an extra pillow under your legs, right? So you're in a 90-degree angle with the knees. And that somehow sort of gives people some time to sort of slowing down, and you can see if you can guide people through them. People in pain barely do that. Finding a position that actually brings the pain down to like 0 or very little. All right, that will be, and that's a part of that control. Actually, you have an option to, well, that depending on what kind of language you use, but if metaphorically that can turn off your alarm system, or that could ease your system, or that could basically give you control over your experience by reducing the load massively, and then you can start building up again from there on, instead of pushing until you drop and taking some meds and then moving on. So I think I just brought up a few options, right? So
Yeah.
I think
So
it's like taking some control here.
that's what I'm hearing. So let me just sort of do my best to summarize there. So we've got, in the moment, some, I would say, little experiments. That's how I would see them. But we've got ways of actively engaging in a behavior, in this case, perhaps finding a posture, a position of comfort and ease, and within that, building the experience of some relative control. So feeding back to the original question, which was, people come with this need for a quick fix, then we are actually meeting them at a need as well there, aren't we? That if we have the ability to create the condition where something feels different relatively quickly, so if it's sort of in a 2 or 3, 4 minutes or something of running this experiment, then we're feeding back into them the notion that they have some control, where something probably felt out of control before that, and maybe was part of that need and urgency and distress that fed that thought in the first place. Am I right in sort of summarizing it in that way?
Totally, yeah. And the whole narrative, so gaining control, and sometimes people need some external, let's say, help, if you like. There's nothing wrong with like support at some stage. When you're totally like, I can only relate to to myself. When I'm totally fed up with something, sometimes I need someone to help me out, right? To give you that perspective, or giving that, like, just listening. You just need to ramble a bit, and then you feel much better afterwards. So this is what patients happens too. So instead of telling them they'd have to take control, you could also help them to give that feeling of control, at least for a bit. And I could be a part of that control at that stage.
Yeah.
And I don't think there's anything wrong with that, allowing yourself to do some touch and even if you do a manip and people feel like, oh, that's something I might need. So that could be, I think there are reasons why you could do that, even though you might not fully, we don't fully understand how a manip could lead to pain reduction, or even if it will be a massage, could be things of doing. I think it's like a care you take at that stage, and it doesn't gonna. But I don't, and I think that's probably one of those things. It shouldn't be the thing you do over and over and over thing again. So probably it's gonna, if you stick with the quick fix, or you stick with, then clearly and apparently the therapeutic process has somehow got blocked or stopped.
Yeah.
You're not going to move forward, and I think that's something you have to sort of be careful about, because if you can't move on, there must be a reason for you why you can't. So that's probably another conversation. How you gonna cope when people still in this need of
Absolutely.
quick fix or relief, and it somehow doesn't, it probably prevents you to move on in your therapy.
Yeah. You beat me to it, Bart. Because I was going to say, we've got, and it sounds like this simple sort of flow that someone comes in and you build this nice relationship and they feel comfortable with you, et cetera, and you run an experiment and it's successful. But the chances are we're going to meet people where this doesn't happen and they're going to
Yeah, or
crash a bit.
occasionally, right? So they may do well for
Yeah.
a while, but they just come back. Oh,
And they go, look, I've done it all. It's still not working.
yeah,
I just want you to fix it. And so let's just spend a couple of minutes just thinking of, and I would say these are super challenging situations as well, aren't they? So, how are you working with those? And I mean, challenging, not that that person is deliberately being challenging to you, but they are difficult for us to work with, aren't they? When you're doing your best, you've tried, what you think is an effective and appropriate treatment approach, but still you're met with that resistance. And
absolutely. Yeah, you can't. Well, I think that's is part of the, let's say, pain treatment. You could schedule like a whole series of sessions that and ask ChatGPT to give you the full like detailed planning of your sessions, but life will kick in because it's not gonna work like that. Sometimes it's good to have this well, let's say that this schedule if you because you want to tick some boxes, right? So you probably want to get to some, let's say, you need to tick the boxes of like relaxing, or let's say relaxation, exercise, sleep, dietary, things that probably needs to be part of your therapy at some point. But I think you have to be very flexible in how things are evolving over the time, and some things need more time, and then at the same time you're trying to keep track on the full scale. I can see there will be, if you're working in a pain clinic, you got 12 weeks and you have to squeeze it in. You have to squeeze in everything. This is one of the reasons why people sometimes drop off, right? So they don't go through the full program because they have this flare up and it takes too long and they're not able to maintain the therapy or maintain the therapeutic process. So I guess that's where it can be very challenging. It's hard to predict as well.
yeah,
But
yeah.
probably then, yeah, I think I have the privilege that I can sort of figure out how we can sort of, if it doesn't work today, we can postpone for next week to next week.
Yeah,
But
yeah,
I think that's a flexibility that's very helpful
yeah.
in the work I do.
But then I think you probably set up a condition where that person is willing to sit with things for another week as well. I'm just going to chime in here, and sadly we're running out of time, but
Yeah, as always.
we will come across really challenging moments in our careers, and that person feels so desperate, and yeah, and you are desperate to be able to offer help as well. And that there is super challenging. Sticking with it, validating how frustrating it must be, scary it must be, etc. And sitting with them through those moments, it's really, that really is, it's hard work, but it's well worth it. And my experience has been those challenging conversations, if you can maintain that rapport and the relationship, and you've built some trust and some safety within that, then there, as those moments sort of settle down, a sort of element of ease comes in, and that person can come back and engage back in with the process that we are offering. So
Yeah, yeah.
it can happen, but you will come across those difficult moments. I always used to think of them as squeaky bum time. You're going,
Yeah,
oh,
exactly
I don't
that.
know whether I want to deal with this, but it is just a part of that.
It's
And you,
hard work.
it's hard
Yeah,
work, yeah. And that person, if you try and sort of see it through their lens, they are scared. And how would you be if you were scared then? So,
absolutely. Yeah, that's. I think that's well said, Tim. And um, when things don't go following the plan,
yeah,
um, well, I think that will be our probably that will be the way we probably should think about planning therapy. Then you need this thorough, let's say, scheduled things that you need to tick off in the back of your mind, but don't expect it to be happening exactly. So this, as you would have planned. So even if it is these bum squeezing moments are there, it shouldn't surprise you. And I don't think you, if you're not following the plan exactly as it was, probably it's gonna not gonna dilute your effect. It's not gonna be a problem because at that stage it's relevant whatever you do, and probably have to listen carefully what's necessarily or what you need to do or what you can do at that stage. So probably more helpful than stick to the plan and say, "Well, I don't have time for this. I hear you have slept very bad and it was terrible, but now we're going to talk about food and dietary." That's probably not going to work out well. So I think this flexibility also goes with probably better results because you can sort of shape it more to the expectations that are happening at that. So it's less confronting in a way, and it's probably not. I think also like bending with your patient a bit, but also bending back, right? So you have to bend instead of break it.
yeah.
I think that's could be a nice way of doing.
Yeah, yeah, yeah. Be bendable.
Yeah.
We had that expression sometimes use it
Yeah.
as being a chameleon. So, you change your color
Yeah.
dependent on the need at that time. But we've run out of time. So I'm going to do my best to
Yeah.
summarize. We started with the navigating difficult conversations. So what happens when someone wants a quick fix? Really challenging at times, but first of all, we talked about just understanding the urgency around that and why is it that that person wants a quick fix, pain and the meaning behind it, etc., what it's stopping you from doing. You can understand that people want to get rid of that. It's not pleasant. That's probably the main thing about pain. Like, it's amazing at doing its job in a way, isn't it? Of being uncomfortable and distressing and making you want to change what you're doing. We talked about then obviously the building your understanding and knowledge around that, their expectations of what that means, some strategies about building some trust and validating the experience, etc. And then what we actually dropped into was the in the moment experiments of being able to empower someone with strategies that offer an opportunity to notice difference and change. And I think that feeds really nicely back into when someone doesn't see hope and that things aren't changing and they just want that one thing, the magic bullet, etc. Being able to work with and offer them strategies. You might not find it straight away. You
Yeah.
mentioned about even a sort of resting posture for back pain. It might be just working with breath. It might be, you mentioned about the green glasses and the red glasses. So literally the way that you view the world might offer the chance that the experience of it changes. And there are times when things don't go as you wished and that person, they persist in that need to change, and perhaps there are confronting times where they're saying, yeah, we've tried it, but things still aren't changing. I just need a quick fix. I'm going to go and get surgery, or I'm going to get a whatever. Oh, I think of so many different times when people are, and you feel a bit deflated in those moments, but you can also understand and being able to engage with those people when it is confronting is a real skill. It can be hard work as well, but also what we've seen is it can be really, really deeply meaningful and helpful in the long run to be able to stick with them. So I think we've done that. So Bart, thanks so much. And everybody who's listening got to this point, thank you so much for tuning in. We really, really value you being with us. And if you can let people know that we're here, share it, like it. We'd love to hear how you use these podcasts as well. We've had a bit of feedback from people, just stimulating conversation in the clinic and being able to use us as a little bit of a sort of part of your team as well, if you're working alone or in small teams, or feel like you're working alone because people are working in such different ways to you. We love to hear from you. So thank you so much for sticking with us, and wishing you all the very best.
Thank you.